The Eating Disorder Questionnaire is a self-report assessment that acts like an on-paper interview, but instead of coming up with elaborate answers for each prompt, patients who have eating disorders simply need to rate themselves based on the questions. The questionnaire has 4 categories that it seeks to assess: restraint, eating concerns, shape concerns, and weight concerns. The patient has to rate the items on the questionnaire based on how they felt and acted in relation to eating food for the past 4 weeks. It's best to issue this to your patient when you need to assess the severity of their disorder and if you want to examine how they exercise restraint, what their concerns are when it comes to eating, and how preoccupied are they with their weight as well as body shape. The following healthcare practitioners may use this for their practice: dietitians, nutritionists, pediatricians, psychologists, psychiatrists, occupational therapists, rehabilitation therapists and workers, and mental health therapists. To use our eating disorder questionnaire, follow these steps. Download our free eating disorder questionnaire from our Carepatron platform, which you can find in the link in the description. Lastly, follow the instructions per section. Respond to the prompts with a rating between 0 to 6. These ratings stand for different things per section, so make sure they carefully read what each number stands for per section. There's also a section only meant for females, which asks them if they have missed any menstrual periods over the past 3 to 4 months, how many have they missed, and if they take birth control pills. Towards the end of the questionnaire, they simply have to indicate their weight at the moment and their height. This version of the Eating Disorder Questionnaire has a simplified scoring system. You simply have to tally the scores per category. Follow the scoring system in the worksheet. If they get a score of 4 or higher, whether it's for a category or global score, that means that it's a cause for concern and should be looked into as soon as possible. Lastly, develop a care plan. After tallying all the scores, you can indicate if they have a severe case of eating disorders based on what they've got per category and what they got as a global score. Make sure to tailor fit the plan to them. You can find our eating disorder treatment plan template in our Carepatron platform. Here is a sample of our eating disorder questionnaire from our Carepatron platform. To find our eating disorder questionnaire, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.